We'd love to learn a little bit about those who have joined us today. So to introduce yourselves, please add your name, location, organization affiliations, and any other information you'd like to share in the chat. Before we introduce our presenters, we'd like to share a couple short patient story videos. The patient advocates in this video truly exemplify why we began this Liver Health Project Echo Group. We know many of you have patients whose stories mimic the ones that are about to be shared, and we are so grateful you've taken the time out of this busy holiday season to join us to learn more about how you can help.
Non-alcoholic fatty liver disease is a disease of your liver that's caused by many different things, but it's not alcohol related.
If you have fatty liver disease, it could develop into cancer.
I was diagnosed 4 years ago with cirrhosis, and it was related to having a fatty liver. It was a very big shock to me. I had never had any major illnesses. For me, it was a difficult thing to accept.
I was a firefighter in Los Angeles, and I got injured. And during that period of time, they kept giving me ibuprofen. I took this for over a year, and I have never had a drink. I didn't smoke I was pretty healthy overall in my life. And then all of a sudden one day, I'm sick. So I went to the doctor, and they told me that basically what would happen is that ibuprofen had really destroyed my liver.
You're not feeling sick, you're not feeling ill. Everything in your life is going great.
I wouldn't have known that it was there until they stumbled across it. Before I was diagnosed, I didn't know anything about liver disease.
Some of the symptoms that I had were nausea, pain in my upper right quadrant of my abdomen, and weight loss.
I was just tired all the time. I began to retain a lot of fluid. I would go from wearing one size pair of clothes one day and then wake up the next morning and not be able to wear those and have to go buy new ones.
And then I started turning really yellow. My eyes started turning yellow, and then I got worse and worse as the days went by.
I was not feeling ill, nor did I have any pain. That concluded that I had cirrhosis of the liver with hepatocellular carcinoma.
Fatty liver disease is not widely talked about, and sometimes it has stigmatizations attached to it.
Everyone thinks that if you have liver disease that you're an alcoholic or you have some sort of other addiction issue that's caused you to have liver disease.
I own the disease, and I fight it every day.
You have a second chance. You do. You change your whole life around. Today, I'm very healthy, I'm very happy, I'm very active.
My entire lifestyle is completely different. I cycle 100 miles a week.
I eat healthy, I exercise.
It's important that people who are unaware of how their health is, particularly people who have a weight condition, go get the blood tests run. Find out, and then advocate.
When I was first diagnosed with non-alcoholic fatty liver disease, I was devastated. Food has brought me a lot of enjoyment in my life. Doctors have told me to lose weight, but they never told me that I could end up with non-alcoholic fatty liver disease. When I looked online for the diagnosis, I was really afraid. It said 10 to 12 years. And in that moment, I began to cry. And I cried for like 2 hours. And it was the moment that I said that this is not going to defeat me. I learned that I could slow down the progression of this disease by changing my diet. I learned about exercise, learned the love of chair yoga. My husband and I walked, my children and I walked. Today, my health is much better. I lost 50 pounds. I still have a ways to go. My family, my children, that's my motivation. I want to enjoy life. I want to enjoy the time that I have left, and I want to make a difference.
Our next speaker is Dr. Helene Jordan. She is the National Senior Director of Research Program Management at the American Liver Foundation. She joined ALF in 2023 to develop a robust research program to ultimately benefit patients with liver diseases. Under her leadership, ALF has issued research awards to promising young investigators in liver research and funded pilot research projects to boost innovation in rare autoimmune and pediatric liver diseases. She has also led the effort to implement the American Liver Foundation Patient Registry, the first patient registry for all liver diseases that was launched in July 2024. Dr. Jordan obtained a PhD in human biology and immunology in France and has extensive experience in academic research, grant writing, and research management. Her research interests include cellular immunology, autoimmune disease, and liver research. Dr. Helene.
Hello, Zach. Thank you so much for the introduction. Let me see. Can you see my screen?
Yes,
Good.
perfectly.
There we go. Well, I'm sorry to jump in the middle, Don. I hope maybe after you restart your computer, I hope you can join back and it works. This was really weird. It's a new Zoom issue. I never heard this one. So thank you again for the introduction, Dak. As you mentioned, I joined the LF last year, and one of the things I've been working on is our American Liver Foundation Patient Registry. The patient registry is the first registry for all liver diseases, which is really why we're so thrilled about it and excited about what it's going to bring on. It was launched a few months ago in July 2024. And the goal of the registry is to collect data about liver disease from the patient's perspective. It's really patient-centric and patient-powered. So in addition to bringing the patient's voice to research and to data, it's really driven by patients. They are the one who can self-enroll and fill out the survey. I'll get to that in a second. And so it's really all about the patient. The participation from patient is really easy. It's mostly for the most part the initial survey is an online survey. It takes less than 30 minutes to complete. Actually, we have looked at the average time of completion from our early adopters, and it's actually way less than 30 minutes. It's less than 15 minutes, actually. It's around 12 minutes in average to complete the survey. So it's really easy. People can do it from any device that has an internet connection, their computers, their laptop, their phone, from the comfort of their own home. It's really easy. It's very intuitive. It's a very user-friendly platform, and I'm going to show you some screenshot in a second just to give you a sense of the experience. And I just want to mention why we're doing that. So besides bringing the patient's voice to research, which oftentimes is missing, and to also to patient care, we are hoping that this is going to generate data that will provide physicians with a better understanding of how liver disease is affecting patients as well as their current treatments, and also eventually help researchers find better treatments and cures. So the amount of data that we're generating is actually quite amazing, and the associations that the researchers will be able to find, because it is for all liver diseases. We really have high hope that it's going to generate great data, great research, and eventually finding that will help patients. So just to show you what it looks like, this is the landing page from our software platform partner, Pyramid. Was developed this platform, so it's web-based. This is a landing page which gives you some generic information. You can access the FAQs from there if you have any issues. Ask for support, and then you can see at the right of your screen here. This is where you go to register. And if you register, that's really what it is. So it's really easy again. We don't ask for a lot of questions in the registration. It's really just about having your name, your email address, your state, and how you heard about the registry. And once you fill out this information, you receive an email to confirm your email address, make sure it's really you. And you have to obviously read and sign an informed consent form, because this is clinical research. So the study has been reviewed and approved by an institutional review board, so that we wanted to make sure that all the safeguards were in place to protect the privacy and keep the interests of patients at heart. Obviously, the platform is also very secure. There's all sorts of safeguards in place to make sure that the privacy and the confidentiality of the data is ensured. And I also should mention that the way that the registry work is that, besides the names, there's really no other identifying information that's entered in the platform. And there are still some measures in place to make sure that, there's a little bit of identifying information, namely the name, is separate from the patient's answers. And there's all sorts of other also technical safeguards, again, to preserve the confidentiality of the data. The other thing I should mention is that, the data once we start sharing it with researchers, will always be de-identified data. So there will never be any kind of private information or personal identifying information, coming out of the registry and shared with anybody. So once people, fill out the initial registration page, consent to the study, then they get to really this first. Sorry, I think I missed a. Sorry, I think let me just try to go back. Oh, I'm missing it. Okay, that's okay. I'm missing a piece, but that's okay. You get to basically the very first screen, which is showing you that there are four main sections in the survey. It's very simple. It's about 45 questions. It's asking patients about their liver disease. So what's the liver disease, which you can see here. Their types of symptoms, complications, what they've been told by their providers, their family history of liver disease. We ask about how patients manage their disease, whether it's through medication or lifestyle changes, transplantation, etc. We ask about other types of medical comorbidities, so any kind of other conditions that could influence their liver health or liver disease, whether it's diabetes or obesity, excuse me, and a number of other conditions. Also asking about some lifestyle questions that could also affect their liver health. And finally, some demographic information. And so the way you see it here is really how the survey looks like. Very simple to answer. Sometimes when we have a long list, like here for the list of liver diseases, you will have, a second list. So if you choose autoimmune liver disease here, you will have this little pop-up so that you can answer, well, which one it is. It could be more than one. So these are all non-mutually exclusive. You can choose as many as applicable, and then you go to the next screen. And so really, again, very easy to use, very user-friendly. And once you have completed the survey, so here are when you get to the first screen, I'm trying to show you, you will have these. And so it's also showing you where you are in the survey as you're completing it. You can stop anytime you want. So if it's taking you a little longer, or all of a sudden you have something to do, you can stop in the middle and sign in later and complete the survey later. You can really go at your own pace to complete the survey. And then once you've completed the survey, then you get to a little dashboard area, and that's what it looks like. So this dashboard area has a number of what's called e-diary buttons. So that's how the platform refers to them. And so these buttons allow you to keep entering data over time for some of the questions that we're asking that may change over time. So some of them are very specific, like for example, your fatigue level, your weight, your blood glucose level. If you mention that you had diabetes, and then some of them are really specifically about liver, like if you have a new diagnosis, if your symptoms are changing, these kind of things. And at the bottom, we also have some resources, which right now are basically just going to the American Liver Foundation website, where we have lots of educational resources about diseases. You can also ask any questions you want. So, if this helps you learn about your disease and or brings up some new question that you hadn't thought about, you can use that to ask us a question, and we can refer you to, either give you the answer or refer you to the proper people to give you an answer. And then another thing that I want to mention about this dashboard is that tab that you can see here that says feedback. So this goes to what the program calls a feedback loop. And what it is, it's a little a screen here that allows patients to see where they fit compared to the aggregated data from all the other people who have participated in the survey so far. So none of this is identifiable. You don't know who filled out what, but basically there's a little menu here that pops up that's open that allows you to look at the most reported conditions, the most reported symptoms, medication, etc., and then you can filter and see where you fit in all that. So the leaf here indicates that the participant um, um, so gives that answer in their survey. And so this is really a powerful tool to see how you compare to other, and to give people, I think, a sense of belonging, figuring out that they're not alone, like we hear a lot, like we heard it in some of the videos. Sometimes these types of diagnoses are really a shock. People really don't know much about the disease. They also don't know if what's happening to them is common, is how it compares to other patients with the same disease. And that's the type of things that you can see here. That you can see, okay, I have, let's say I have, I feel that I had fatty liver disease or MASLD rather than new nomenclature, and I said that I had high blood pressure. Well, I'm not alone. 30% of people also have this, and you can filter here for people who have, for example, a certain disease. So it really helps people see how they compare to other, and eventually we'll use that to hopefully create communities of people and support through the community. But for now, it really helps being your own patient scientist, as they call it, and also see how you compare to other patients. So this is in a nutshell where the survey is now. As we keep going, we're going to have more surveys. So, for example, some quality of life surveys. We're about to roll out in a few weeks certified Spanish translation. So to bring in people who are native Spanish speakers. And we're going to have a lot of other surveys that are disease specific, and all of this is going to generate, a lot of data. And what we hope to accomplish is, I mentioned it a little bit at the beginning, but is, patients participating in the registry is going to generate all this data. And we will share this data with researchers. Again, only the identified data, no personal identifying data at all. And the hope is that this is going to lead to new findings, and some of them will, hopefully lead to improved care. For example, if it really shows that there's a response to a certain treatment that's not desirable, or that there's another way, a better way to manage a certain disease, etc., that can lead eventually to improved care, and improve guidelines for physicians and allied health and care providers in general, and eventually, of course, hopefully some better cures and treatments for diseases, because again, this is for all liver diseases, not just for MASLD and MASH. And just to show you where we are right now, as of yesterday, this is early adopters. We have over 660 patients self-enrolled, which is really exciting. And just to show you like the power of this platform, is that over this patient in just a few months that it's been live, patients are participating with over 15 different liver diseases. They've entered over 1,000 medication data points. Over almost a third of participants have used these e-diary buttons to keep entering data about their changes in their disease, changing their symptoms. And we've already collected over 150,000 data points in just these few months. So again, lots of open what this is going to accomplish in the future. And last but not least, share with your patients. We will put also the links in the chat. But I wanted to show you, we have this one pager, which is a fact sheet. Here's a QR code to access it, and that you can share with your patient. You can show them your QR code. If you want, you can print it. If you want us to send you some printouts, we're happy to do so. It just gives some basic information about what the registry is about. And this is a link directly to the patient registry where people, again, can self-enroll. And again, this is patient-driven. They don't need to do it through their medical providers. They can do it themselves. But we just, we just hope that you can, spread the word and tell people and your patients about the registry, and tell them how they can participate and really participate in research. and really play an active role in research. I think I will stop there, and hopefully we can have Dr. Rockey back, and I'm hoping that this time it's going to work. And I'm happy to answer any questions at the end. Thank you so much, Zach, for the opportunity to talk about it. And I'm also happy to answer any questions you may have down the line. I'm the American Liver Foundation, so feel free to contact me if you have any follow-up question. Thank you so much.
Thank you, Dr. Jordan.
Helene, quick question. If people need printed copies, should they contact you directly or someone else?
Sure. Or they can email us at research@liverfoundation.org, and I can put that in the chat.
Thank you.
We're going to reintroduce Dr. Rockey here. He had some technical issues earlier, so we're going to have him start over from the beginning again. But Dr. Don Rockey is currently a distinguished university professor and director of the MUSC Digestive Disease Research Center and has active research portfolios in basic as well as clinical science. His laboratory focuses on mechanisms of liver fibrosis and has coined the field of molecular portal hypertension. He has also been actively involved in clinical research focused on liver fibrosis and portal hypertension. Dr. Rockey has authored and co-authored over 500 scientific manuscripts focused on GI and liver-related topics, including a number of seminal basic science and clinical studies. He is a committed educator and is a particularly dedicated mentor, having mentored some 150 different trainees, ranging from undergraduate students to junior faculty members. Dr. Rockey, the floor is yours.
Thanks again, Zach. It's a real pleasure to be here. I'm coming to you from Charleston, South Carolina. Nice and sunny, but a little cold this morning. It's early December, and we're not used to freezing temperatures. But I'm delighted to be here. And I thought today I would talk about, or I've been asked to talk about MASLD, a little bit of an introduction, and a little bit about the disease itself, and then focus on where this field is going in the future. So let's see if I can carry on. Okay. So this disease, as hopefully everybody recognizes, is a disease really of Western culture, and I think it's a disease that has been facilitated greatly by our diet and habits, our lifestyle. So I put this slide together a little bit tongue-in-cheek, but this really is a big part of the problem is what we're eating, as well as the lack of exercise. So I like this physician here who says, what fits your busy schedule better, exercising a day or being dead 24 hours a day? And I think that really helps epitomize and emphasize the issue with MAFLD. So this is a cartoon that I put together with data from the CDC, which shows obesity trends among US adults, self-reported obesity trends, which is about 30 pounds overweight or a BMI over 30. And you can see that 25 years ago, the country was, had a modest amount of obesity. Things have been changing over the last 25 years. And you can see here in 2010 that many states, a quarter of the population was considered obese. And now things have really become problematic, in which a huge swath of the Southeast and middle part of the country considers themselves obese. And there are some areas now, the latest data suggests that there are some areas where as many as 50% of people are considered to be obese. So given that obesity is one of the major risk factors for the metabolic syndrome and for fatty liver disease, this is an enormous problem and really an epidemic in the United States. And I would say that it's really a silent epidemic, which is emphasized by this patient who I'm presenting. This is a patient I actually saw some time ago, who was, at the time I was on service, and we admitted this gentleman with jaundice. He had a past history of obesity and hyperlipidemia. That was really it. He was told some 12 years previously that he had NASH, now MASH. And at the time, he really had a fairly unremarkable physical examination. His laboratory data are really only notable for slightly elevated aminotransferases, which is very typical. So these patients, and as you heard in the patient stories, many patients don't know they have this disease. And in fact, it's estimated that only a small proportion of patients with MASLD or MASH know that they have a problem. But in any case, because of this gentleman's abnormal liver test, he had a liver biopsy. This is a picrocereus stained red liver, which gives you beautiful staining of the fibrosis, which is red, and then staining of the hepatocytes, the liver cells, which are green, and then fat, which is white. So you can see that this patient has a fair amount of fibrosis and a lot of fat. Shown below here is a normal liver where you can see really very little to no fat, and only the only fibrosis that you see is in the vasculature. This is actually a portal vein, and that's really all the fibrosis that you see. So why is fibrosis a problem? I'll come to that in just a second. To follow on with this patient's story, at the time, when he was initially seen, he was told to modify his lifestyle and control his diabetes. He represented then 11 and a half years later, 6 months before the current admission with ascites and shortness of breath. And this is a cross-sectional CT scan shown here, which shows the heart here, the ribs here are all white, but this dark area here pointed to in the yellow is fluid. And so he's got what we call an hepatic hydrothorax. You can see in the sagittal image all this fluid. This is his liver over here. And he's basically got a right lung that's completely full of fluid. This is a horrible complication of cirrhosis and portal hypertension. And really, the best treatment for this is TIPS. So he had a TIPS, and this got a great result. His pressure, or hepatic venous pressure gradient, was lowered from 22 to 6. And so his fluid went away. Unfortunately, he then developed progressive liver failure, jaundice, as indicated on the physical exam previously. He had muscle wasting, which basically tells us that he's developed liver failure, and he was quite ill appearing. His bilirubin was 8.7, INR 2.1, and his MELD was 25. So at this point, his only option is liver transplantation. His liver is failing, and we don't have any real therapy for him. So this is the problem. And again, this is a silent disease, which strikes patients sort of unknowingly. So again, coming back to the fibrosis story. So why is fibrosis important, and why should we have recognized when this patient had that biopsy some time ago that there was going to be a problem? Well, this is an elegant study that was performed in Sweden, in which they took a large number of patients who had a liver biopsy at baseline, and then they followed these patients for up to 40 years. And you can see the problem is that patients with fibrosis at F2, F3, or F4. So F0 is no fibrosis, F1 is fibrosis just around the portal tract, F2 is fibrosis extending out of the portal tract into the liver. F3 is bridging from one portal tract to another, and F4 is bridging with thick bands of scar tissue. So F4 is basically histologic cirrhosis. But what you see here is that even at F2, these patients have reduced survival compared to patients with F0 or F1. So little bit of fibrosis teeny bit of fibrosis may be okay, but any significant amount of fibrosis here, F2, F3, or F4, is really a problem. And so basically, I live to stomp out liver fibrosis, and whether it's NASH or hepatitis C or any of the various liver diseases that the LF is concerned with, all fibrosis is bad and leads to poor outcomes. It's important to recognize that fibrosis is not unique to the liver. It obviously is very important for us in the liver, but fibrosis is probably the leading cause of death worldwide for all people. You can get lung fibrosis, heart fibrosis, kidney fibrosis, pancreatic fibrosis, skin fibrosis, even in the eye. And all of this scar tissue leads to organ dysfunction and ultimately death. So how does this develop? It's actually, believe it or not, conceptually relatively simple. There is injury to the epithelial cell in whatever organ. In the liver, it's the hepatocyte. This cell becomes injured. It activates or causes activation of effector cells and inflammatory cells, which then produce the scar tissue. The cell in the liver is known as a stellate cell. We've been studying stellate cells now for the last 25 years, and stellate cells are really the problem. They're producing the scar tissue, which ultimately leads to cirrhosis. So therapies that can prevent the stellate cell from producing this scar tissue are probably going to be effective. I'm not going to show you data in that area, but I'm going to show you another sort of story. This is a slide that was given to me by Ian Wanless, of a patient who had hepatitis B. And I think we would all agree there's a lot of scar tissue here. The scar tissue is stained blue. The normal hepatocytes are stained red. And so there's a big, huge swath of fibrosis here. And this is what we call a regenerative nodule. So this is advanced fibrosis and cirrhosis, histologic cirrhosis. This is high magnification. This is lower magnification here in panel B. And you can see all this scar tissue. The patient was treated with lamivudine, which suppresses the virus, reduces the inflammation, causes deactivation of those stellate cells that I just told you about. And this patient has basically complete reversal of the scar tissue and a normal looking liver. And there are data in other diseases now that suggest that we can actually reverse fibrosis. So in hepatitis, viral hepatitis, alcoholic hepatitis, MASH, there are data now, and I'll show you just quickly some data, autoimmune hepatitis, and even in uncommon diseases like bile duct obstruction and iron overload. By treating the underlying disease, you can reverse fibrosis. So the point here, and I just want to emphasize that the point is that fibrosis is dynamic and can be reversible. I'm not going to talk about all these various pathways. These are the data on fatty liver. So this is a study that was actually done in Cuba of a large number of patients where patients with NASH underwent lifestyle changes. So they were asked to exercise and diet. And a significant proportion of them did, in fact, lose weight. I'm not sure why my slides are going nuts here, but sorry about that. So what I'm showing you here is that focus on the patients who have this darker blue colored here. These are the patients who have regression of fibrosis. And you can see in the patients who lost more than 10% of their weight, the majority of patients had regression of their fibrosis. So again, consistent with this idea that you can cause reversal of fibrosis. And there are other studies in patients who've had gastric bypass surgery that if you lose weight, you have reversal of fibrosis. We're seeing data now with the GLP-1 agonists, so semaglutide and others, that these are likely to cause reversion or reversal of fibrosis. So switching a little bit to clinical trials and where we're at now. So I hope that most people now are familiar with resmetirom. So this is the only FDA-approved medication for the treatment of MASH. This was a large study, a very well performed study called Maestro. It was published in the New England Journal of Medicine. I'm not going to go through all the details in terms of the methodology, but suffice it to say that the primary outcome here was NASH resolution with no worsening of fibrosis and one-stage improvement in fibrosis with no worsening of NASH. And what we see here is that in this graph is that resmetirom was associated with a significant reduction in fibrosis. So over a 10% reduction over the placebo. I would also emphasize that most of these trials see a reduction of fibrosis in the placebo group. And this is probably what we call the white coat syndrome or a placebo effect. And this is because when I'm seeing our patients in clinic and they're on a study, I'm constantly asking about lifestyle modification, weight loss. So even in the patients who are not on the active drug, they're probably effectively treating their liver disease. Where do we stand now? So this is a slide where I've put together all of the big studies. I've just shown you the data on resmetirom. There actually is a trial now of this drug in patients with advanced fibrosis, so who have that F4 that I showed you before. We don't have data on that yet, but the data so far are promising. There are a whole slew of other studies, and these are the major ones. There are even now some other ones that are out there and are studying various stages of NASH and MASH with early fibrosis and even advanced fibrosis. But these are big studies, a lot of patients. They're for the most part all in process or progress right now. And so I expect we are going to see that some of these are going to be effective for treatment of MASH. So what does it look like in the future? So where are we gonna be in 5 or 10 years? So I think that, and again, I'm showing the histology of the biopsy of this patient who developed progressive fibrosis. When we see a patient like this, we're as a clinician, we're going to say, stop, time out. We have a problem here. We will assess the disease progression risk, probably using a combination of clinical markers, which I think you've heard about in previous talks, possibly genetic markers, and probably laboratory markers. We will then institute some sort of therapy. We clearly have therapy. We know that weight loss and lifestyle modification work. We know that resmetirom works. We suspect that many of these other compounds, the GLP-1s in particular, are going to work. And then based on risk, we're going to begin one or more of these treatments. I think that ultimately, probably by the time I retire, we will start a treatment that addresses more than one part of the pathway. So patients may wind up on a medication that causes weight loss. If the patient, such as shown here, has significant fibrosis in their liver, we may start a drug that attacks fibrosis. So we may have specific antifibrotic drugs. And then we'll follow these patients, our patients with non-invasive markers. I don't think it's going to be practical to do liver biopsies on everybody. But I think that's where the future is going to lead us. I think the future is very bright for this disease and most liver diseases. And with that, I would also be happy to answer questions. You can find me. There's my email there. You can Google me as well. Happy to address anything I can. So thanks again, and sorry about the IT hiccups.
All right, well, amazing presentation. So thank you all so much again, and thank you so much to everyone who also attended this session. This was our last session of ECHO for this year. However, stay tuned for future sessions. The recordings from all 5 sessions are being edited and will be uploaded to our YouTube page, and everyone who registered will receive a link soon. There is also a survey within the iEcho portal, and we'd appreciate it if you take a moment to give some feedback on today's session. We hope you have a wonderful holiday season.